Examine the patient standing with both arms and shoulders exposed. Important anterior landmarks include the clavicle, acromion, and acromioclavicular joint. Important posterior landmarks include the scapula and scapular spine. Inspect both shoulders for asymmetry suggesting muscle wasting, particularly over the deltoid, supraspinatus, and infraspinatus. Also note any erythema, deformity, or skin lesions, including surgical scars. Then palpate for tenderness over the clavicle, acromion, acromioclavicular joint, subacromial bursa, and also palpate posteriorly over the supraspinatus and infraspinatus. Note any excessive warmth as you touch the shoulder. Move the shoulder through a complete range of motion and note any limitation. If necessary, compare range of motion to the unaffected side. Range of motion testing includes flexion and abduction. Because some patients compensate for shoulder pain or limited mobility by using scapulothoracic motion to abduct the shoulder, you may try stabilizing the scapula while abducting the shoulder. Test internal and external rotation. Internal rotation can be measured as the highest vertebra the patient can touch, compared bilaterally. Alternatively, you can test both internal and external rotation with the arm abducted and elbow flexed to 90 degrees by rotating the forearm upward for external rotation and downward for internal rotation. Or you can test internal and external rotation with the elbow at the side and forearm flexed 90 degrees by having the patient rotate the forearm across and then away from the torso. Test for impingement syndrome by detecting pain with passive motion during certain maneuvers, such as the Neer Test and the Hawkins Test. To do the Neer Test, stabilize the scapula with one hand and passively flex the shoulder until the arm is above the head. Elicitation of pain is a positive test. To do the Hawkins Test, stabilize the shoulder with one hand, flex the shoulder forward to 90 degrees, flex the elbow to 90 degrees, and then internally rotate the shoulder. Elicitation of pain is a positive test. Test for injury to the AC joint using the cross-body adduction test. Stabilize the shoulder with one hand, flex the shoulder forward to 90 degrees, and bring the arm straight across the front of the body. Elicitation of pain is a positive test. Do strength testing for weakness that suggests specific injuries. To test for rotator cuff injury, have the patient externally rotate against resistance. You can also ask the patient to abduct the arm to 90 degrees. If she is able to do that, then gently push downward on the abducted arm. If the patient is unable to actively abduct the arm to 90 degrees, do a drop arm test by passively elevating the arm and letting it go. Inability to maintain the position against gravity and mild resistance is a positive drop test. For another rotator cuff test, have the patient hold the palm against the belly and push the elbow forward against resistance. Test for supraspinatus weakness by pushing down on the flexed arm held with the elbow extended and thumb rotated down. To test for bicipital tendonitis, palpate over the bicipital groove for tenderness and do a speed test by pulling the arm back while the elbow is straight and forearm supinated. Test for anterior glenohumeral instability by stabilizing the shoulder from behind and pulling back on the abducted arm, increasing abduction and external rotation. A positive result is apprehension of joint instability, not pain.